Um, just, just so you're aware, my name is Erin Colburn. I'm the pre-health advising coordinator for the College of Health Sciences. And I'm ecstatic to welcome both Taylor Willis, our occupational therapy student who's on staff at the College of Health Science, and a Boise State University alum from University of Mary with Dr. Janeen Sibla. Did I say it right? Sibla?
Sibla.
I apologize.
Yep,
So
that's all right. It's a
from the
different
University
one.
of Mary. This is a doctoral occupational therapy program, which there aren't as many as you would think just yet, but they will all be, so they're ahead of the ball game when it comes to that crafting. So I'm going to turn over the time to both of them and let them do some of the talking.
Well, welcome. Thank you for having us. So Taylor's actually a student right now doing a doctoral experience in capstone. And so she is the one that kind of got this arranged, and I'm the program director at the University of Mary. And so we're going to talk a little bit about what OT is, and then the University of Mary and our program. So we'll get started, and I think Taylor's going to start at the beginning.
Yeah, so Dr. Sibla gave me the privilege of talking about what is occupational therapy. It's surprising how many people don't really know what occupational therapy is. I still in my fieldwork, Scott, I already have a job, or I already saw physical therapy. Why do I need to see occupational therapy? So sometimes it's nice to put words to that definition. And so that's what this slide is kind of doing. And so OT helps people of all ages to do the things they want and need to do through therapeutic use of daily activities, which we call occupations, hence occupational therapy. So we help people live full and meaningful lives. So we promote health, we promote prevention, and to live a better life with an injury, an illness, or a disability, kind of within the focus of independence, right? We want you to be as independent as possible so you can live your life as full and as meaningful as we possibly can. And so where do OTs work? They can work in a wide variety of settings. I didn't know this until probably I really got into the profession. It blew my mind how many options I have, which just makes it really versatile, which is why I really gravitated towards the profession. So you can work in hospitals, schools, outpatient clinics, mental health, any lifespan you can basically work with. Neonatal intensive care units. You can own your own private practice if you want to. You can be really specialized and work in a cardiac rehab or even a specific rehab center, maybe with spinal cord injuries or strokes and different diagnoses like that.
You can work with injured workers. You can work in factories. It's amazing. It really is. And we're just expanding more and more. So Taylor is spot on. We work everywhere.
So why pick OT? OT is an essential job, right? You want a job to where you're valued and that you have that placement. And OT is one of those. So there's the highest job satisfaction. They're ranked that we're needing OTs. We're needing them in the future. We're needing them now. And so that is just job security at the end of the day, right? The median salary is comparable to the amount of education that you need. It's listed right there. And so about $84,950. And I think that solidifies the amount of education and the work that you're putting into this profession to know that you're getting a good monetary value out of that.
Mm-hmm. New graduates usually make between $50,000 and $60,000, but I've seen as high as $75,000. And there is continuing education, reimbursement for school loans, those types of things as well, depending on how much difficulty they have finding therapists. All right, you want this one or you want me to take this one, Taylor?
You could take it.
All right, so as far as education for OT, you actually can get a degree at any level. So we have the associate's and bachelor's degrees that are assistant levels, and you're going to see most of those at associate level. That's just moving into the bachelor's level. And then to be an occupational therapist, you either need a master's degree or a doctorate degree. Either degree is sufficient and will get you into entry level. What I can tell you is that doctoral degrees are more focused on advocacy, leadership, administration, those types of things. There may be openings in administrative type positions that if you don't have a doctorate degree, you wouldn't be eligible for. The American OT Association is moving more and more, people who are a part of that, schools who are a part of that are moving more and more to that doctorate degree level. And you'll see that continue to roll out. all the states in North Dakota, Montana, South Dakota, and I believe Minnesota are doctoral degree programs. So you're seeing it roll out pretty quickly. Any questions about OT before I jump into our program?
We do have one from the chat. What kind of OT work would be done in factories and in that sort of setting?
Yeah, so in a factory type setting, you would work on ergonomics. You would work on safety on the job. You might work on wellness and stress management, those types of things. My husband actually works for Workforce Safety and Insurance of North Dakota and helps injured workers get back to work. So he teaches them how to do job seeking skills. He does interview preparation. He does a lot with adaptive equipment. So do you need a special chair? Do you need a special keyboard or a mouse or those types of things in order to enable you to do your job? Great question.
Are there any others before we move forward? You can put them in the chat or you can voice them. Okay.
All right, so I'll tell you a little bit about the University of Mary. We were founded in 1959 by the Sisters of Annunciation Monastery, and the sisters just live right down the hill from us. They are some of the spunkiest women you will ever meet. They came here from Minnesota. They voted by secret ballot. They got on the train and they came to North Dakota and they started a grade school right away and a hospital in Dakota Territory. And that like spirit of, you know, entrepreneurship and new things is very much alive amongst us still with the sisters. The sister who actually came on the train, the last living sister, just passed away last year. She was 103 years old. She was just amazing. In 1989, we became the University of Mary instead of Mary College. And we are faithfully Christian, joyfully Catholic, and gratefully Benedictine. Gratefully Benedictine is we are Benedictine College. Saint Benedict was a monk and he taught people how to live in community and live in harmony. And so we have 6 values. I am sure Taylor could name those to you without even having seen them on the screen because we talk about them a lot. Community, hospitality, moderation, prayer, respect for persons, and service. That makes a good OT. And so it's super easy to integrate that in to our program. And we are a value-based education and we try and help our students not only just learn the technical skills about OT, but also how to have a really meaningful career or vocation. We are called to healthcare and we help people to care for the people that they serve. One of the things that I think is really neat about the University of Mary is that healthcare nowadays is a commodity. I think most of us can talk about a negative healthcare experience we've had, service or someone who wasn't very kind to you or those types of things. At the University of Mary, we really focus on health care. You are providing care to people, and how do we ensure that we are providing care at that client-centered level and not just a commodity of productivity. So we are the St. Gianna School of Health Sciences. St. Gianna is a modern day saint, and she gave her life for her unborn child. But one of the things we talk about is dignity of life, and how does that relate to an OT? Well, if you were going out to dinner tonight with your friends, do you want them to feed you? Anybody? If you were in an accident, do you want your mom or dad or friend, a stranger, to shower you every day, or do you want to do that yourself? Do you want to take care of your own business in the bathroom? As an OT, we deal with very intimate daily activities, and we help people to do those independently and maintain a sense of dignity in who they are. So that's part of how it relates to us. We have lots of different disciplines here. We have graduate and undergraduate programs. So we have nursing programs that go all the way through the doctorate level. We have a doctorate of PT program. We have a speech and language path program, which is new, relatively new, haven't had that for too long, super excited. Athletic training, which is just moving to the master's level. Exercise physiology and kinesiology at the master's level. And then exercise science, respiratory therapy, and rad tech are all undergrad, and we also have respiratory at graduate. So that's a picture of our newest dean. She just started this year, Dr. Mary Doctor. She's a PT by background, and no grass grows under her feet. She's wonderful to work with. And if you're in town, she'll take you up on a game of golf. She's a fabulous golfer. So our program started in 1996 as a bachelor's degree program, and then very quickly moved to a master's program. At our master's level in 2013, we started a program in Billings, Montana. And so we are over on Holman Street in Billings. We take 16 students there. I have 3 full-time and 1 part-time faculty member there. And when we started, we were the only OT program in Billings. We since now have another program there, but we're currently the only and first accredited OTD program there. In 2018, we launched into the doctorate level program, and we added our Fargo, North Dakota location. If you don't know where Fargo is, it's on the way eastern part of the state, right next to Minnesota, and it's the biggest city in North Dakota at over 100,000. So, you know, a big place. Just here in December, we received our full accreditation of our doctoral program with no areas of non-compliance in our accreditation report. So that really speaks to our faculty, but also our students and the amount of work they did in helping us prepare for that. So as I said, we have 3 locations. Bismarck accepts 38 students and Fargo takes 12 students. Bismarck has 8 full-time faculty, and we connect via Zoom just like this with Fargo. And so one day you might have an instructor out of Fargo teaching. For example, Dr. Kevin Anderson, he is certified in assistive technology. And he even knows like about robots and all kinds of things like that. And he worked in the school system. And so he has a lot of really fun stories to share and tell our students where I know nothing about assistive technology and you don't want me to teach that to you. So we have the best teachers teaching that information they know the best. Fargo takes 12 students and we have 2 full-time faculty there. And then Billings takes 16 students and we have 3 full-time and 1 part-time. Every site has its own labs that are held face-to-face. They have their own equipment. Quite interestingly, people will ask, do you have cadavers? We do not have cadavers. We have what's called syndavers. If you go and look at them, syndavers were actually on Shark Tank. They are synthetic cadavers. So they are like made out of rubber, essentially. They feel kind of like a hot dog. That's what I would describe it as. Taylor's kind of giggling, yeah, hot dog. And our students have one in Billings, they have one in Fargo, and we have them here and we share them with PT. So we can use those syndavers, and they're really cool. We just got them in Fargo and Billings this year. As I said, we're accredited by ACOTE, the Accreditation Council of Occupational Therapy Education, and no areas of non-compliance. We got the maximum time for accreditation. So we're really proud of that. So why pick us? Like there's a lot of OT schools out there. What makes our program unique? First of all, you're going to get a ton of hands-on education, and I'm going to tell you about all those experiences. We have a pro bono clinic. So we offer free OT services to clients that are in need in all our locations. That is a student-ran clinic. Okay, I'll answer questions about that and tell you a little bit more about it as we go too. We also have our community level 1 fieldwork. So all locations, for your first level 1 fieldwork, so you start our program in the summer with an online course. The next summer, you have the option, which I'm going to show you pictures on the next slide, of going to Peru. And we take our students for an international fieldwork. They provide services for a week. These are some of our master level students, and they worked on wheelchair modification with these kiddos. And then they also have a week to travel while we're there. If you choose not to go to Peru, you get to work in the States with an OT for a week. The other 2 fieldworks that we have are community-based, and one of them is working with individuals who have mental health issues or concerns or at risk related to mental health. That's focused on group therapy and learning how to do group. And the other one is working in assisted living or nursing homes, and that works alongside physical therapists. And how are we doing some home evaluations, wellness programs, those types of things. So lots and lots of hands-on learning. The students, I was just in clinic right before I got here, and they were working with an individual. Taylor's gonna probably smile about this one, a guy who's about 26 who had a head injury. and they are working on his balance and use of his left hand. And they're working on some bowling activities with him. And then they're also working on some stress management. The other students were working with a small child. He's probably 7 or 8, but he's small in stature. He has Duchenne syndrome, which is a type of muscular dystrophy. And they're working on energy conservation and how to help him transfer in and out of the tub safely. And they're doing that via telehealth because he doesn't even live in Bismarck. So lots of things going on in terms of working with patients today. As I said, you learn alongside other disciplines like PT, speech, and others, nursing. So these are some of the pictures. The picture with the clocks on the wall with everybody dressed in black, that's actually at Bismarck State College. You might even be in that picture, Taylor. Who knows? We actually taught the nursing students there some things about transfers and how to transfer people safely so they aren't hurting their backs, and to use proper body mechanics. And then the other one is some of our pro bono clinic activities where we're working with other disciplines. And then the first picture is probably our baby lab, where we bring in well babies and do reflex testing and those kinds of things, and work alongside the PT students. That's baby lab's like one of the most favorite things. Everybody loves the day baby lab happens. Another reason to choose UMary is our faculty. When you ask students what are one of the best things about UMary, they're going to say faculty. Oh, Taylor, I was going to give you a chance to talk about the pro bono clinic and the working alongside people. Let's go back a slide.
That's okay. You were just cruising along.
I know, I got excited.
I found a lot of value in this, and that's why I felt like I wanted to talk about it. In fieldwork, I mean, healthcare is an interdisciplinary work. It is, you are working with other people, and provided that within your education only gives you more confidence as a practitioner. In fieldwork, I worked in acute care, and I had to interact with physicians, nurses, nursing students, physical therapists. I had to do co-treatments, things like that. And I had a leg up because I already did it with the University of Mary, right? I already got graded on it. I already got, what do I maybe need to improve on? What do I already do better? And Baby Lab is the best thing in the entire world. You just get to hang out with a little kid for like the whole afternoon. It was a really great experience. So this is one of my favorite parts about the OT program for sure.
So a lot of times if I ask students what's the best thing about our program or UMary, they tell me 2 things. One is community, the people I meet, and my class. And the second thing they'll tell you is the faculty. If you ask the faculty, they'll say the students. But our faculty have worked, we have pediatric outpatients, therapists, school-based OTs, rehab, home health, working with developmental delays, working in I worked in mental health and psychiatry, acute care, you name it, we've worked at. Somebody's done travel therapy. So like I mentioned, assistive technology, working with all kinds of populations and experiences. So we have a lot to share. The other thing that happens is that you have mentoring in 3 different roles from our faculty. So you have a faculty advisor. So I have about 5 or 7 students that I meet with every single semester, and we talk about their professional skills, and we'll talk about that in another slide because we focus a lot on that. But I get an opportunity to visit with them for about 20 minutes every single semester. You also have a research preceptor, and I'll talk about that in a bit, and you have your capstone faculty mentor. I am Taylor's capstone mentor. So she emails me every week. I have another group of students that we get on Zoom and just chat once a week and how are they doing. So you have that really strong connection with a number of different faculty. You know, faculty have office hours. We don't abide by that. Our doors are open. You can come in and talk to us pretty much anytime you want. We enjoy interacting with our students and being a part of community with them. So the other people on the slide are the other administrative people. So Dr. Kitzenberg is our program director in Billings. She's from the Billings community, has been there forever. She's had private practice in pediatrics, has done some adult work as well, but peds is her gig. And then Dr. Kevin Anderson is our site coordinator in Fargo, and he's also a peds guy and assistive technology. As I said, he has more toys over there than anyone can imagine. So here's a picture of our Sindaver, actually. That's what they look like. We have the pro bono clinic, which I mentioned. People are referred into that. I get a lot of questions about that. And there's lots and lots of other options. So the other picture is a picture of Violet, one of our faculty, Dr. Julie Sandvig. She's a peds therapist. Her dog is a therapy dog, and Violet comes to school every Thursday. Go ahead, Taylor. You want to offer a little thoughts about all your hands-on?
Yeah, I mean, as a practitioner, you do, right? You're doing something. And so through all of these hands-on activities, I feel like I gained a lot of those skills before I even had to go on field work so I could further improve them, right? The pro bono clinic was one of my favorite. When she says that it was student-led, it is student-led. I mean, you're doing the administrative work, you're doing the planning, you're doing the research finding, and then you're also the therapist. And so that is really your time to figure out who you are as a therapist and figure out what you like, what you don't like. And that's those kind of opportunities that they provide you, which I really enjoy. Practice lab, there are just other opportunities for you to do the things you need to do.
One of the things I really like about the pro bono clinic is some students, the classroom's not really where they shine. They have to really work hard at class, but then you turn around and in pro bono clinic, and they're the ones that can form a relationship with those challenging clients, or they have really neat ideas for intervention. It's fun to see them with patients, really where the rubber meets the road. So I mentioned fieldwork. Fieldwork, we have level 1 and level 2. Level 1 fieldworks are generally about a week of time, 40 hours, and they're interspersed within a curriculum. Level 2 fieldworks, we're mandated to have 24 weeks of level 2 fieldworks by our accreditation. We have 2 12-week experiences. One of those experiences needs to be an adult practice. So it can be in a nursing home, a rehab, it could be in acute care. And then your second one can be in pediatrics if you wish. Some people don't want to do pediatrics. If you don't like kids, you don't have to do kids. But it is really up to you where you want to do that. We use a matching process for all level 2s. So some colleges use a lottery. So I have 38 students in Bismarck. If you're number 1, you pick off my list of sites, you get the top pick. If you're number 37, you take the leftovers, so to speak. We don't do it like that. We have a list of lots and lots of sites, more sites than we have students, and you pick your top 8 to 10 sites that you're interested in that meet what you want to do. So if you really want to do outpatient pediatrics, or you really, really want to do a mental health fieldwork, you put down your choices and we try and match you so that we are ensuring that your learning style, your interests are aligning with your fieldwork. We have had very, very good success with our students, and I can count on one hand, I've been here 18 years, the number of students who have not passed the level 2 fieldwork. So that matching process really ensures success. The other thing that's important to know right now, in the middle of COVID, we had 100% placement of our students. That says 2 things. One, our students were really good about being flexible about going to different places. When their site got canceled, they may have just said, yep, I'm going to Aberdeen, South Dakota. I'll be there in 2 weeks. I'll figure it out because I want to graduate on time. And it also says a lot about our fieldwork coordinator who found over 50 new sites so that our students can go on fieldwork. So we're 100% on time graduation for anyone who wanted to stay on track. And we have locations for our fieldwork out throughout the whole entire United States. We have them in the Midwest. I was just talking with Aaron and said our students we send to Coeur d'Alene tend to stay there. They like it there. They live there. We have Washington, you know, the Midwest, Arizona a lot. We have some in California, Florida. The only place where we don't have a ton is the Northeast, and they're just really inundated with lots of OT schools, so it's pretty competitive to get in there.
Yeah, and I'm an out-of-state student, and so this too was a big pull for me. I'm not from North Dakota. I'm from Washington, and then I went to school in Idaho, and I wanted to go back towards family, right? I was away from family for 2 years doing my studies, and I wanted that option to maybe go back to where I wanted to work, to get that networking, to build that social circle. And so I got that opportunity. They already had some set in Idaho, and so I just applied and I got accepted. And that was something that I really valued about the fieldwork experience. But I have friends that are in Florida and Arizona and Utah, and they're across the US doing these really awesome things in Texas. And so even if you don't want to go back to where you're originally from, there's tons of options due to that being that there's locations across the US.
Taylor even has a classmate from Hawaii who is there currently. So we might be a little envious of him.
Absolutely.
We do have students from across the nation that come to our program. A lot of students from Washington, Oregon, California. I have a student from Australia. I just interviewed someone for next year from Maryland, Arkansas, Alabama. So we get them from everywhere. One of the things that we do a lot with our students is help them to develop professionally. For example, being to class on time, being able to manage your time well, being able to manage stress really well, demonstrating really good communication skills and assertiveness, ability to resolve conflict and collaborate with others. Because those skills are something you can build now. And then when you get to your field work, you can focus more on your technical skill development. So every semester you meet with your faculty and complete a self-evaluation of your professional skills on 10 different skills. Faculty also complete one on you, and you set goals on the areas that you want to improve and identify strategies of how you're going to do that. Our students are really well known for their professionalism. In fact, I just got an email this week from a therapist. She actually is the director of a pediatric outpatient clinic, and said, your students are always professional, respectful, and ready to go, and we appreciate that. So well known for that, and we enjoy helping them reach their professional goals. So research, most people either think, oh, great research, or oh, great research. Our students do a full research study under the guidance of an OT. So all of the faculty have an area of research they're interested in. Some people are working with professional issues or fieldwork, or Parkinson's disease is another area, the experience of widowhood, engagement in occupation and falls prevention, mindfulness, all kinds of things. So you work alongside with a group of students, and you do the whole entire thing, from developing a research proposal that goes through our institutional review board, and then you implement it, you do your data analysis, you write a paper, so a manuscript. And the two pictures you see here, the first one is a group of students actually from Billings that are doing a presentation on their research at our annual School of Health Sciences Research Colloquium. And so you do an 8 to 10 minute presentation with a group of other disciplines. So we have that with all other OT, PT, speech, nursing. And then you also do a poster presentation. That's a group of my research students with a poster on mindfulness that they did. And we have been very successful having our research accepted for presentation at the national conference put on by the American OT Association. So we've put lots of student research out there, and we're always excited about being able to share their projects that they've done. And as I mentioned, mentorship is just really important. You have lots of one-on-one assistance from your faculty advisor, your research preceptor. I meet with my research groups every single week, even if it's just like, how are things going? Give me an update. How's the writing coming along? And then your doctoral experience in capstone. We meet with those students twice a semester while they're developing their idea. And then when they're on their deck, whatever amount of time, some students need more time, and I meet with them weekly. Taylor's just flying like crazy. So she just sends me a weekly update, and this is what she's doing. And if anything comes up, we can meet. Taylor, did you want to talk a little bit about some of your experiences related to that?
Yeah. At a bigger university, it's challenging to find those mentorship opportunities, especially if you are a passive individual. I had a hard time facilitating those relationships sometimes. And I found that it really flourished when I went to the University of Mary. Again, you walk down the hallway, all your classes are where their offices are. And when she says that there's office hours, but we don't really follow them, that is very true. If their door is open, I can bug them, and I would bug them. But that only developed better relationships. And with those better relationships, I felt like I became a better practitioner, because I felt like I could ask them the difficult questions. I could really get to know them and be a better student because of that. And so I really value the mentorship opportunities and that close relationship I was able to build.
We like being with our students. We'd rather be with our students than in our offices, honestly. So let's talk a little bit about application and what's required. So all of our applications go through OTCAS for all locations. You can have a bachelor's degree in any field. So I have people who have degrees in Catholic studies, for example. You just need to have the prerequisite courses, which I'll talk about in a little bit. So applications for summer 2021 are open right now. And I do have a few slots open yet in Bismarck. Billings is full and Fargo is full. So I can accept seniors still. If you have seniors who are looking to apply, you know, we will still take a look at those applications. If you're thinking of a 2022 start date, those applications will open in summer of 2021. And I'll fill you in on a little bit of tidbit. It's not even approved yet, but I know it will be. We're going to put forward something called priority and acceptance, and we're going to start accepting people who are juniors in college and save those spots for them a year in advance, which is really nice because a lot of students, it's like, oh, I'm going to apply. If I don't get in, then I'm going to take sort of a gap year before I start grad school, or you can apply as a junior. And we haven't set those criteria yet, but we are looking to start something where those students, and that way, if they're in, they have a spot. And if not, then they still can apply their senior year and really work on bringing up that GPA or what other things they need to beef up that application. So here's our prerequisite courses. You'll find they're fairly consistent amongst OT programs with some slight variations. A&P 1 and 2, you can have an anatomy one semester and physiology one semester, that's fine too. Chemistry or physics, either one. We see some people who prefer one over the other. And then the psychologies, we're very holistic in our care. We care not only about your physical body, but also how you develop as a human being and your mental health. So you have general psych, developmental, or lifespan. I'm looking for the lifespan. So sometimes you see a child and adolescent one and then adult and geriatric. That's also fine, but it has to cover the whole lifespan. Abnormal psych, stats, either from math or psychology, and then medical terminology, or we can do a passing grade on a competency exam as well if they didn't take that class. We require a minimum 3.0 GPA in our prerequisite course. They have to have a C in any of them. So you could have, if you have a C in stats, but you have an A in anatomy, that's still a 3.0, you're good. You can only retake 3 of the 7. We also have a minimum GPA of 3.0 in the prerequisites. A personal written statement, and it's generally what got you interested in OT and why you want to be an OT. And then 3 satisfactory letters of reference. One of those references needs to be from either a work supervisor or an OT. 20 hours of volunteer within the last 2 years with an OT. This year we waived that for nearly every single student, and we've done some other things in terms of having them watch some videos or that type of thing, because with COVID, you just can't get in to volunteer, and you know, we don't want to penalize people for that. If you have international candidates, there are minimal TOEFL scores, and you can find them on our if you just Google UMary OTD program, it'll be the top of the list, and you can find us real easily. So we score everybody, and then we invite them for interviews. We had face-to-face interviews last Friday for all of our sites, but we also did a lot of Zoom interviews. We understand flights are expensive. It's hard to get away. And, you know, a blessing of COVID, we all do Zoom, and we're really used to it, and we're very comfortable with it. It's just the new norm. Each student is interviewed with the same set of guiding questions. You know, tell me about yourself. Why do you want to be an OT? What do you like about OT? Some self-evaluation things. What are your strengths? What are your challenges? Why UMary? What about our school is interesting to you, and why do you think you'd be a good fit? All the students are scored on that list of questions, and so we take their GPA scores and their interview scores, and then we're looking for completion of their references with all satisfactory, as well as their volunteer hours, and they're given a score, and then we invite the top candidates to come. And we look at students very holistically. I want to talk to the student that has a 3.25 just as much as I want to talk to the 4.0 student. And so some students just really stand out in the interviews, and they have a lot, you know, to offer and are very interested in OT, and they've applied twice. And we're going to look at that student as much as we're going to look at the 4.0 students. And so we're a little bit different in that way. So if you have any questions about our program, you can get in touch with me. Of course, Taylor has all my contact information and could help you as well. And wondering what kind of questions you have for me about the profession or OT. Somebody put in, what kind of volunteer experience do you accept? Does it need to be in the medical field? 20 hours with an OT is what we prefer. You know, the more settings that you're in, the better you're going to do in your interview, because you can say, I saw this when I worked with geriatric population, I saw this when I worked with pediatrics population, those types of things. Other volunteer hours are always helpful to working with people. The more you work with people in general, you know, my work when I was in college, even high school, I worked as a waitress. And let me tell you, as a server, you learn to deal with every kind of personality there is. That's good experience to be a healthcare person. It just is. Working with people in general is just, versus sitting behind a computer and doing data entry. Other questions?
Free to place them in the chat if you're not comfortable, but I hope this is a casual experience that you can feel confident with this, asking any questions.
This is, I guess, kind of just a general. Do you have to be Catholic to go to?
No. No, you don't even have to be Christian to come here. I have all kinds of students here, all faiths. You definitely have a feel of Catholic here. You're going to learn about Catholic health directives and those kinds of things, but it's just education. I mean, it's like any other type of thing. The more you know about different things, you're going to have patients who are Catholic, patients who are Lutheran, patients who are atheists. Taylor, maybe you want to talk about that part of.
Yeah, I don't identify as Catholic, but I feel like the healthcare profession as itself aligns with the Benedictine values. And so I think a lot of people find a lot of similar values within themselves and their morals that fall within that. And that is what the basis of this program is on. So we're serving people, right? We want to respect others, that autonomy. That's just something that the healthcare field has just overall. And so that's what really pulled me to it. And I don't identify as Catholic.
Great question.
What's the average length of time for a student to finish?
They finish our OTD program in 3 years.
3, okay.
Yep. I do have a couple of students that are taking a bit longer, and they chose to take some time off due to medical issues or those types of things, which we work with them, you know, collaboratively. I have a couple of students in my next class who are having babies and they want to take a semester off. So we'll work with them on those kinds of things if they want to step out a semester.
We have a question in the chat. What is the annual cost of the program?
So the whole program, it's easier for me to tell you that because some semesters you're full-time and some you're part-time. And so tuition and student fees for our whole entire program is just a little under $90,000. A little bit less at our Billings location because they don't pay as much for parking.
We also have a question about with regards to rotations and locations. Do you provide or assist with housing?
So we do not provide assistance with housing. However, you're a part of a class. And as a class, it's amazing how many people are like, oh, you can live with my Aunt Tilly that lives here. The other thing is they find housing, and there's a lot of times the educators, so the OTs that are at that hospital have connections to people who are willing, you know, oh, I know another OT, you can live in her basement for 3 months. It's really kind of amazing. Taylor, how'd you find your housing?
Yeah, both my parents live in the area. However, both of my sites, within the early processes of accepting me, asked if I needed housing, and they had that developed within their field work, as well as like public transportation. And so they provided that information to me in case I didn't have the resources.
Mm-hmm. Excellent questions.
Questions?
Can you talk a little bit more about the courses or the parts of the program that teach students how to work with the different areas from the different walks of life, or from
Sure.
people with difficult personalities and stuff like that?
Yep. One of the classes we have is called Therapeutic Use of Self, and we talk about different approaches. Some people prefer more of a teaching mode. They want to know exactly A, B, C, and then help them walk through it. The next person's like, leave me alone, I want to figure it out myself. And so we work with them on how do you change that approach and how do you have a different approach. We talk a lot about values and different values. They have part of their group therapy class is they do therapy with each other. And so we challenge them on maybe some rigid thinking or some exposure to different ideas and concepts. You know, one of the activities, I didn't do it this last year, but you are, I don't know if I don't think I did it with your class, Taylor, but you had a list of 12 people and you only have 10, 5, whatever machines that can save their lives, put them in order. And then we talk about our bias. So is it age? Is it work? Is it gender? Is it sexual orientation? Whatever those kinds of things are. And so we talk about those things. You know, one of the things that personally, as a vocation, as a healthcare person, we are called to care for, love, however you want to say that, the people that we tend to. And so regardless of that background, you know, being a faith-based institution, I always, Jesus wasn't hanging out with the people who were doing good. He was hanging out with the lepers and prostitutes and tax collectors. So we have a lesson to learn there about who we need to love and take care of.
We also have a question about age range of students.
Oh, we have students, most of our students are typical. However, we always have a few in the class who I have had teachers come back to school, a massage therapist. I've had a couple of vets in our curriculum that have come back. We have all sorts of different folks that come in. So we have parents, we have single parents, a number of different backgrounds in our program.
Other questions? If you don't ask them, I ask them.
You know, one of the things that's really nice about OT is that it is so diverse. My husband's an OT, and I always he's like the best example of this. He started working in child and adolescent psychiatry, then he moved to adult psychiatry, then he moved to adult rehab, then he moved to adult rehab community reintegration, and now he works with injured workers, getting them back to work. Never went back to school. I worked in mental health. I worked in the inpatient psychiatric unit. That was a locked unit. And then I had the opportunity to start a partial hospitalization program where the patients came in during the day and got therapy and went home at night. I loved that setting because they could practice all the skills and things that they were learning during the day. That was primarily mental health focused. We then added a dual diagnosis component to it. So people who had addiction issues along with mental health. And so I worked in that program for a number of years, did a little of outpatient. And then I've been in teaching for 18 years. And teaching is like a whole new, what's a rubric? How do I correct? How do I make a PowerPoint? And so that's a whole nother avenue that people don't necessarily even think about as an option for an OT.
Do you apply for a specific one of the locations, or do you get placed?
You pick your location where you want to attend. And so let's say you pick Fargo, but Fargo's full and you're really high up on our list in terms of qualified candidates. I'm making all kinds of phone calls this week and saying, hey, I still have an opening in Bismarck. Do you want to come to Bismarck and stay on the wait list for Fargo? And if someone decides to go to another school, we'll transfer you over to our Fargo location. So we do that with Billings and with Bismarck and Fargo. Bismarck accepts the most students, so it's the easiest place to get into as far as location. But we work collaboratively amongst the three places. Katie, I saw you're interested in pediatrics. I have lots of pediatric therapists and lots of pediatric interests. We have a lot. Our curriculum is very heavy on pediatrics. So as you start looking at OT schools, find out, you know, what kind of coursework they have in pediatrics if that's your interest. It's always good to, do they have courses specific in pediatrics? Are they integrated? Can you do a field work in pediatrics? You know, and then as soon as you decide pediatrics, you change your mind when you start working with other discipline, other ages. But a lot of people start out interested in pediatrics, that's for sure.
Yes, actually, when you mentioned Dr. Kitzenberg, I don't know if I said that
Yes.
right, in Billings, I have family in Billings, so that's why I got super excited about that. And you mentioned she was involved in pediatrics.
Yes, if you're visiting in Billings, you just get my contact information from Taylor and I can connect you to her, and you can go do a little tour and visit it and see if it's the right fit for you. Or Billings is fun. Their secretary has potlucks and brings them food all the time. I'm quite envious of them.
That's awesome. Yes, thank you.
Yeah, there's about 16 students there, so they're a tight-knit little family.
So I had a follow-up question from before, so I apologize, Olga. The other question about the rotations is there a time break in between jumping from one rotation to another, or do they have to like kind of hit the ground running and go into their next clinic rotation?
Taylor, how much time did you have?
I had a weekend, but mine was, it was COVID, right? I think
Yes.
a lot of people were switched around. I had someone leading me on a little bit and then they were like, no, just kidding. So I had to find one real quick and be flexible.
Yeah.
So I had a weekend, but I luckily got it kind of fit in. So I think we were just thankful to be placed. But I think we were supposed to have about a month was in between is what we were set to have.
So it's 12 weeks. We usually start right at the beginning of the semester, and our semesters run 15 weeks. So 15 to 16 weeks, depending on the semester. So usually they have 3 to 4 weeks. That little cushion was very helpful because if anyone was exposed to COVID and had to be stuck at home or start late or those types of things, they still could finish in time.
We also had a question about, do you find that specific personalities work better with certain demographics, or do OT students have similar personality traits?
In terms of working with certain demographics, I think it just depends on personal interest. You know, kids and elderly are a lot the same in some ways. They want that individual attention. They enjoy time with the therapist and are motivated to make changes. So I would say that's just an individual preference. And the other question, similar personality traits? Yes, I would say OTs are caring. I would say they're creative. They're very interested in people and they want to know the personal experience of something. So if, you know, I always, you know, some people's like, well, OT and PT. PTs are a lot more like medical doctors. They're very like, okay, so this is what we're going to do. This is how we're going to do it. And where an OT is like, how are you doing today? Oh, does your leg hurt? Oh, I'm sorry. Like, can you take a bath? Oh, that really stinks. So they're much more relationship focused, I think. OTs are problem solvers, trying to figure out new ways to do the same things. You know, you think about it, okay, let's say you can't put weight on your right foot and you need to take a bath or a shower tonight. How are you going to do that? An OT will tell you to get a little tiny step ladder, you know, a little 4-step one, throw a towel over it. You're good to go with a walk-in shower. You're fine. You know, things like that you can figure out how to make things happen. How do you tie your shoe with one hand? Yep, there's one-handed shoe tying. You can find it on YouTube. It's hard to do. So That's what I would say an OT is. Taylor, what do you think? Anything else you want to add?
I would agree. It is a big people person relation focused. She mentioned therapeutic use of self, and I feel like that really is occupational therapy. How am I going to connect with this person? That's how I'm going to get the best relationship and the best results with them. And so I would agree that if you love people, then OT is a really great fit.
And a desire to help people help themselves. Like, we just don't help people. We help them to figure it out and live independently. The best thing in therapy is when your patient doesn't need you anymore. You've been successful.
I should share what Shannon just shared. She said that, Taylor, you now have a requirement for next week. You need to teach us at staff meeting how to tie our own shoes with one hand.
With one hand.
So at staff meeting next week.
Done.
There you go.
That's
There
your
you go.
assignment. I have a question for both of you. So it's, what was the most valuable experience you've had as an OT, and what was the worst?
My best OT story is pretty simple. I worked with a woman when I was working in mental health. She was probably about 25, 24. She ran away at the age of 13 due to a significant amount of abuse at home, lived on the streets of Chicago prostituting herself. She had 2 small children with disabilities. She herself knew nothing about how to cook a meal, how to budget, none of it. So I went to the store with her and we bought the ingredients to make hamburger helper. Okay, most people learn how to make hamburger helper when they're about 10, right? We went to her house, we made hamburger helper, and of course, working in mental health, she's got depression, anxiety, suicidal thoughts, all this. I turn around and look and she is bawling. That's not usually a good thing in psych. And so I'm like, okay, what's the matter? And she said, you taught me how to feed my kids. I do not have to feed them hot dogs and sandwiches anymore. The power of something so simple to change someone's life so dramatically. And I think the hardest things for me as a working therapist, working in mental health, were the clients that died. Clients who were suicidal and discharged and died. And you know, the thing about mental health and psychiatry is that depression can be fatal. And certainly when you see that happen with young people and are unable to make a difference or help, and it's a very helpless feeling, but it also makes you extremely determined to make a difference in the next day.
Thank you. Taylor?
I would say my best experience was similar. It was a complete turnaround. This woman was just having I think her worst day ever. She was just having a lot going on. She was in the hospital and it was, okay, you're not safe to go home. We have to choose a sniff. We have to choose another option. And it sparked a light in her. And she's like, no, wait, wait, hold on. I don't want to do that. And then we worked with her for about 2 weeks to get her to be able to go home safely and to be able to have home health, to get back to her house to where she didn't have to go somewhere she didn't want to go. She wanted to go somewhere where she could flourish. And seeing that switch and that kind of light be switched in her was really powerful. And it kind of showed me the role of OT, right? It's about helping someone help themselves. And so that was super cool and like a full circle moment in my fieldwork. That was super awesome. And I would say the most challenging is, I think anybody likes to feel appreciated. And so it's hard to go into a room and with those challenging people. And I think as a student, that was really hard for me. People who just, they don't want you to be there. I've learned, I got tough. My lady was like, you need to get tougher. That's what my CI always said. And so that was definitely, I think, just really challenging. I haven't had too many experiences since a student, but that was really hard for me as a student, was that not being able to build that relationship, right? As a people person, you want to, and you just got to help them and then leave. And that's your role sometimes.
So we have time for one more question. And then Taylor, would you be willing to put your email address in the chat so that Katie and anybody who wants to chat with you could do so?
Mhm.
That would be
There you
great.
go.
Cool. Last question. Who wants it? Maybe even Dr. Sibla would like to ask it.
Probably, I think a general comment is that OT is something people don't know a lot about. And so sending them to that AOTA website, they can get some information. And it's really diverse. Like there's so much to do that people who enjoy teaching, because you teach people how to do new things. I like healthcare. I don't like blood. I don't like body stuff. I'm really interested in how families work, social work types of things. Like it's kind of all that put together.
I'm going to put it in the chat, but there is an AOTH YouTube channel, and I'm telling you,
Yeah.
it's amazing.
Yeah. AOTA.org has tons of things going on. We at the University of Mary have a Facebook page, and I post a lot of stuff of what our program's doing and what we're up to. If you're interested in kind of keeping track of us, we have lots of things going on too.
Cool.
And we post from all locations. So
Awesome.
thank you so much for having me and Taylor for setting this up. It's just been really fun. Anytime you want to know more about OT, I'm happy to talk.
Well, I truly appreciate it. We've done this as an advocates for students so that because of the fact that there is very little access right now because of COVID. And so we're using this as an opportunity for students like Katie to get some, you know, it's not going to be the same as shadowing, absolutely. But
Right.
starting the conversation and having a relationship, Katie, with individuals that are OTs who can sit and talk with you. We've encouraged many of our students to choose to do informational interviews.
Yes.
And
Great idea.
we think those are just as powerful as, you know, getting a chance to do a shadow
Yeah.
or an observation. And we're very hopeful that through the summer that will change, of course, you know, and that we'll get some more options. But the more relationships you can build, you know, Taylor has OT student friends and people who are in her program at University of Mary.
Yep.
This does nothing but support that idea of it's just about knowledge gathering, if anything, with the idea of, okay, if I create a relationship with someone, there's value in that. And we can then see where we can go with it. You know, is there a volunteer activity or is there a fundraiser or is there something that we can put our hands into and get that experience so that we can still be viable candidates for OT school, but have that. So I value this extremely and I want to thank you for your time. I know that it's a busy schedule for you. And we, again, are so thankful to have Taylor on staff with us this semester. She's been a delight and she's been fun and she's created new ideas that we haven't thought of. So thank you for sharing her with us. Yes. And Katie, you are more than welcome to hang out with Taylor. She loves doing what she's doing. So thank you so much
for supporting our students. I appreciate it.
You're welcome.